Hello, my name's Alexa Hach, and I'm a DRPH student with an epidemiology concentration, and my final presentation for this course is Understanding Iowa Primary Care Providers' Knowledge Level of Syphilis Detection, Treatment, and Follow-up, a mixed method study proposal. This will also serve as my dissertation proposal. The purpose of this proposal is to understand Iowa primary care providers, or PCPs, knowledge level of syphilis detection, treatment, and follow-up care. The study design used will be an explanatory sequential design, where first we start with the quantitative data collection and analysis, then move to the qualitative data collection and analysis, and finally bringing everything together with integration and interpretation of both data strands. So why study this topic? Why is this important? To provide some background information on this proposal, it's important to understand how cases have increased not only across the United States, but across Iowa. In the United States, there has been an upward trend of syphilis cases. What was once an infection of old has made a resurgence. According to the CDC, syphilis rates have surged, increasing almost 32% from 2020 to 2021 for all stages of the infection. Over 176,000 cases of all stages of syphilis were reported in 2021. Cases of congenital syphilis, when the infection is passed from the mother to the baby during pregnancy, rose by about 32% during the same time period, with over 2,800 cases reported and 220 stillbirths and deaths. The last time cases were nearly this high was in 1950, when 217,000 cases were reported. The 2021 data shows that STIs continue to disproportionately impact men who have sex with men and younger adults. Additionally, a disproportionate number of cases were diagnosed among Black or African Americans and American Indian and Alaskan Native people, groups that are more likely to face social conditions that make it more difficult to stay healthy and access care. In Iowa, we also see those increases reflected in our surveillance data. Here you see all stages of syphilis case counts for the past 10 years in Iowa. Keep in mind that we saw an increase prior to the COVID-19 pandemic. In 2022, Iowa saw under 900 cases, and Iowa is considered a low morbidity state. Of the cases reported in 2022, over 600 were in the early or infectious stages, meaning that someone is very transmissible to someone else. Over 60% of the cases were among men who have sex with men, and the number of cases among women has more than quadrupled in the past 2 years. Iowa also sees disproportionately impacted populations in the American Indian, African American, Alaskan Native, and the Latinx populations. Many social determinants of health and health equity factors are the causes for this. Congenital syphilis is also a concern in Iowa. In 2021, Iowa saw 11 congenital syphilis cases, which was more than the state had seen in the last 20 years combined. Case counts continue to be high, and in 2022, Iowa saw 8 congenital syphilis cases. If syphilis is left untreated, there can be very serious health consequences that are not reversible. This includes blindness, hearing loss, cognitive changes, paralysis, damage to joints, and other health-related issues. Congenital syphilis can cause miscarriages, stillbirths, prematurity, death, or low birth weight. And for babies that are born with congenital syphilis can cause deformed bones, anemia, problems with organs, blindness, deafness, meningitis, and skin rashes. The research questions for this proposal will focus on Iowa PCP's experience diagnosing and treating syphilis, meaning are they able to identify the signs and symptoms associated with syphilis and prescribe the right medications to treat this infection, as well as Iowa PCP's experience with the different testing sequences that are available. Currently, there's the traditional and the reverse algorithm. The traditional used to be the gold standard for the testing sequence. There's a growing body of evidence to suggest that the reverse algorithm is better. So what do they know about these different algorithms? What's done at their health system? Are they able to interpret both of these algorithms? And finally, what's the relationship between syphilis knowledge level and the different provider characteristics? So demographic information, how long the provider's been in practice, the type of provider that is there. I want to understand these different relationships among the different provider characteristics. And I, as the researcher, hypothesized that there will be knowledge gaps identified in the study. Moving on to the methods of my proposal using the explanatory sequential design, we start with the quantitative data collection. I intend to survey PCPs in Iowa through the different medical societies and the licensing boards. I do have a validated survey instrument from a similar study that was done in 2017 in Rhode Island, where they looked at provider knowledge among different types of providers in their state. And I plan to adapt and modify the survey to meet the needs of this study. The format of the survey will be available in REDCap, and survey questions include demographic information of providers, provider characteristics, and questions will be related to knowledge level of syphilis. The data will be analyzed in SAS using descriptive statistics and frequencies, as well as analysis of variance or ANOVA to examine differences in responses among the different provider types, so physician, nurse practitioners, and physician assistants, to see if there's any statistical significance among the provider types and knowledge level, as well as Pearson's correlation coefficient to look for correlations between the provider types and knowledge levels. Moving on to the qualitative data collection and analysis phase, I plan to collect qualitative data in the form of semi-structured interviews with Iowa PCPs. The interviews will be recorded and transcribed, and the interview questions will emerge from the quantitative data, and this is also where the sample of participants for the interviews will come from. The data will be analyzed looking for themes and trends that will be coded, and I hope to use a qualitative software to help me in this analysis. One software that I am currently looking at is In Vivo. And finally, the quantitative and qualitative data will be integrated and interpreted as the last part of the explanatory sequential design. The qualitative results in this study will be used to explain the quantitative data in the interpretation. And the rationale for using this design for this proposal is that the problem is quantitatively oriented, meaning that we can quantify the information collected in the survey as well as the semi-structured interviews, and we know the important variables. We also know that a validated tool has been identified and participants will be available for a second phase of data collection. And I, as the researcher, do have time to collect the data in two different phases, as I'll be using this proposal for my dissertation. And since I work in this field, I've also been granted work time to work on this proposal, as it's been deemed a high priority given the increasing incidence in syphilis in our state. So by using this design, the qualitative information will provide a deeper and more comprehensive understanding of the quantitative data and the knowledge level of PCPs in Iowa. Here is a visual diagram of my proposal using the explanatory sequential design, using that quantitative data collection and analysis of that survey, then building to the qualitative instrument, which are the semi-structured interviews, and then analysis of that information, and then finally integration and interpretation of the study. Here is my timeline for my proposal starting in January of 2024 for planning and preparation. Then we'll move to the quantitative data collection and analysis in March, and then building the qualitative survey instrument and sampling in April, then moving to the qualitative collection in May. And in June, we'll have qualitative data analysis, as I suspect that might take longer. And then in July, we'll move to integration and interpretation of the mixing of the data. And then in September, my hope would be to bring everything together and be able to defend and then submit for publication in November of 2024. The public health implications of this study will help us to better understand what the knowledge level is of Iowa primary care providers related to syphilis detection, treatment, and follow-up. This may also inform medical provider training, as well as public health intervention strategies related to how we communicate and educate PCPs in Iowa related to syphilis. This may also inform policies and involve key stakeholders to make changes. And the ultimate goal is to improve patient and population health outcomes for Iowans. The research dissemination will hopefully be to publish, as well as distribute findings throughout the Iowa public health channels, which include the Iowa Public Health Association, the different medical societies in Iowa, and conference presentations and social media. Here are my references that I used for this presentation and my image references. Thank you for viewing my presentation and your attention. I welcome any of your feedback. Thank you.